Hello to everyone. On behalf of Mojca Biltz and myself, I would like to thank Ulla Peterson for inviting us to present our experience with disseminating and implementing SHE tools in Slovenia network of health promoting schools. Slovenia network of health promoting schools was established in 1993 with support of Ministry of Health and Ministry of Education, starting with 12 pilot health promoting schools. From the beginning, national coordinator of network has been National Institute of Public Health, with 9 regional institutes of public health, where regional coordination took place from 2008. Today, after 27 years of existence, our network consists of almost 400 schools distributed in 9 regions, which presents 58% of all primary schools, secondary schools, and dormitories in the country. We, regional coordinators, have educational meetings with team leaders from health promoting schools regularly 3 times a year. We organize different conferences for teachers about health promotion in school setting and in general, provide them with current information about health and health promotion, with different materials for health promoting activities, and so on. With all that, health promoting schools are trying their best to introduce health promotion and healthy lifestyle to daily school life. At the end of the school year, each health promoting school has to report their activities and progress with an online questionnaire. Collected data are used for various analyses at the National Institute of Public Health. As a member state of SHE Network, we are delighted to have possibility to use SHE tools. In previous years, we were able to translate and adopt to Slovenian conditions all 6 documents listed on the left with help of the SHE Secretariat. Vilnius Resolution, Odense Statement, Fact Sheets number 1, 2 and 6, SHE Online School Manual, SHE Rapid Assessment Tool, and School Action Planner. We also prepared workshops to introduce SHE tools to health promoting schools through selected health promoting teams. They were held at regional meetings for team leaders of health promoting schools and their co-workers. We are also very eager to promote SHE newsletters and encourage our member schools to contribute sharing good practice. Here are 2 examples of our use of SHE tools. In April last year, we decided to actively address the issue of reducing the weight of school bags. That is why we organized educational workshops to present SHE School Action Planner and health promotion in school setting for our regional coordinators and also kinesiologists or physiotherapists. With their help, we held workshops at regional meetings with team leaders of health promoting schools in May and June last year. As a result, all participating health promoting schools prepare their action plan to reduce the weight of school bags, with follow-up after 1 year. Secondly, we adopted SHE Rapid Assessment Tool to Slovenian conditions, and we named it Kriteriji zdravih šol, in order for health promoting schools to evaluate their health promoting policy every 2 or 3 years, which we set as a condition for participating in our network. Just recently, we conducted a small survey among health promoting schools in Ljubljana region, which is the largest in Slovenia, to get feedback on their use of SHE materials. Here we present some of the quotes. Team leaders evaluated SHE materials as useful as checklist when planning activities of health promotion in school setting, as prepared in a way to guide you towards intense thinking, networking, and action making, as source of action-based ideas and inspiration when there are obstacles to overcome. We also found out that the most frequent use among three SHE materials, online school manual, rapid assessment tool, and school action planner, is equally distributed in daily school setting. Just to add, one-third of health promoting schools in Ljubljana region answered an online questionnaire. This spring, we translated and adopted also newest SHE materials. Materials for teachers, learning about health and health promotion in schools, key concepts and activities, and European standards and indicators for health promoting schools. We are planning to present them also through workshops on regional meetings with health promoting schools until the end of this year, most probably online workshops because of the epidemiological situation in country. We held our first workshop in Ljubljana region for almost 100 team leaders from health promoting schools, and they were most excited about presented activities which they could use in the classrooms. We are all still very well aware of coronavirus pandemic, which caused that also in Slovenia all schools were closed from March until end of May this year. During that time, our main goal was to support health promoting schools in Slovenia with credible information about pandemic and sources of help for schools on regular, daily basis. We all found ourselves to be searching for new ways for health promotion to reach students, their families, and teachers according to pandemic circumstances. We put special attention to domestic violence, psychological support for teachers in stressful situations, adequate nutrition, indoor physical activities, and sharing examples of good practice. In early stage of pandemic, we sent a letter of support to all Slovenian primary and secondary schools in order to get familiar with the situation of students and teachers in relation to pandemic, and also to draw attention special care for vulnerable children from socially and economically endangered families. We encourage them to share examples of good practice during pandemic, which we published on the National Institute of Public Health website addressed Teachers to Teachers during COVID-19. I would like to end my presentation with some beautiful pictures of my country, wishing you all to stay healthy. Thank you for your attention.